I wanted to talk about some of my seizures. I think it's really helpful to hear other people who have seizures describe them, especially the odd ones that are difficult for me to describe. And I know some other people have difficulty describing them, and I think the way that we can connect is if we share with each other what we experience the best we can say it, and then maybe we can have people who don't have seizures understand kind of what we're going through. So I just wanted to talk about some of my simple partial seizures. I have been having seizures since I was 12, and I had tonic-clonic seizures, and then I was finally diagnosed with simple partial seizures as well. And so what it means is that I have focal epilepsy, which means that there's a certain place in my brain where the seizures start, and most likely it's in my temporal lobe, one of them. And the seizures start there, which is your area of memory and emotions. And so the seizures can be very strange. They are, when you call it a simple partial seizure, it means that there's no change in consciousness. So I don't actually lose awareness even, and definitely I don't lose consciousness. So in a complex partial seizure, you have the situation where you may not remember the 2 minutes that it happened or something. But in a simple partial seizure, you experience the whole thing, you remember the whole thing, and when it's over, you know what happened. So one of the hardest things for me is that the actual experience tends to be not only physical, but also emotional and mental at the same time. And so I was very confused for a very long time, not knowing what my seizures were. I didn't know what they were. I thought I just could not understand my brain. I didn't understand what was going on, and I just felt like I didn't know. And I didn't know how to explain it to people. I didn't know how to share what was going on, because I just felt like I could not really understand it myself. And it is hard to share it when you don't understand something or really don't know how to say it. Nobody gave me a manual on how to describe your seizures. So anyway, these are some of my seizures. I used to have a lot of deja vu seizures, and I really liked what I read one time. Somebody said that your seizures feel more real than real life. And a lot of my memories of during the times that I was having a lot of seizures, because there were some chunks of time where I was having a lot of tonic-clonic seizures, and I am quite sure I was having a lot of partial seizures during that time. And that was before any medication helped. So, because I tried a couple of them and they didn't work at first, or those ones didn't work. Now I have tried more medications, and I have found I'm on two that do help. They don't completely control all my partial seizures, but they do control my tonic-clonic seizures. So I'm grateful to have that. I sometimes, though, what I remember is a lot of these memories I have are of these intense moments. And I'm pretty sure that these intense moments were seizure moments. And that's actually mostly what I remember from my life in ages maybe 16 to 25, something like that, where, especially till 22, 19 to 20, 17 to 22 was really bad. And I had an eating disorder, so I wasn't eating enough. I was anorexic, so I wasn't eating enough, I wasn't sleeping enough, because I was having all these seizures, and I would get really scared, and I would get out of bed in the middle of the night and go walk and wander and do stuff like that. So some more of the descriptions. So lots of times the deja vu feeling, and the deja vu is just very intense. I feel like some people said to me in my life, oh, I have deja vu too. And I just thought, okay, everybody has deja vu. Well, it happened to me a couple times a week that I would have this crazy intense deja vu that it was like as if suddenly the world was happening the same exact thing again. And it was really nerve-wracking because it was confused. Like, I didn't understand it. I'm like, why do I suddenly feel like I am doing something that happened before? And I would think that there was something bad about that. Like, it would just suddenly, I would have this confusing feelings of, like I said, of just deja vu, and then oftentimes it would cycle into some other parts of the seizure. So I would have, most of the time, a deja vu at first, and then some kind of rush of emotion, lots of times fear. I would oftentimes just get this rush of adrenaline, and so I would go, having the deja vu, and then it would be like, oh my God, and it was the kind of fear like a tiger is chasing you kind of fear. It was not fear that made any, specific sense about what was going on around me. So for me, it was crazy, because suddenly I'm feeling these things. Like, it is life or death situations. And that was really scary and so confusing. I know I say the word confusing a lot, but it was very confusing to have these kind of seizures and to not know they were seizures. Because the thing is that the only way to treat them is to treat them as seizures and get them to stop through medication, surgery, whatever you do. But treating them as psychiatric disorders or as in a psychological manner it doesn't work, because you can't stop them by doing therapy. So I know there are psychogenic non-epileptic seizures, and that's different. Those can be helped in other ways, but actual epileptic seizures are not helped by those things unless, say, you're doing things like meditating that help reduce your stress level. So there are many things you can do alternatively besides medication, etc., that can help slow or make your seizures less frequent. So I totally agree with that. I'm just saying that you need to treat seizures as a neurological problem. So once again, I would have the deja vu oftentimes, sometimes just deja vu, but it was so clear. And I don't think people understand that kind of deja vu. That it was so clear, it was scared me. And then, like I said, I would have this fear feeling. And then sometimes after that, actually a lot of times, I would have this crazy intense feeling that I was going to make the worst mistake of my life. So someone described it in a book one time called A Feeling of Impending Doom. And I thought that kind of says it all. Like, it just felt like I was going to, in a moment, be just, I don't even know how to say it. This was on an everyday basis. So I would, the strange thing is I don't know how much it was happening, because all I remember are these seizures. I actually don't have, during the times of about 17 to, 22, I actually have no other memories other than ones that I would say are seizures, because they are all so vivid, so intense, and almost always the same feelings. And so that is upsetting. It was hard for me to come to terms with the fact that I have no memories of my life except these seizures during that time. Well, I didn't understand at the time that they were seizures. It's really important to understand that, because the only way you can treat it is if you realize they're seizures. And if not, you keep thinking that you have something going on in your brain that you do not understand, and that it's your fault, and that you should be able to fix it. And what I'm saying is, those things are not true. You can't stop seizures on your own, most likely. So whatever treatment you need to do, it's like you need to know that you're having seizures first. And so the reason I want people to understand is that they need to realize that if you have these types of seizures, you need to diagnose them. So I'll just say some more of them. I used to have ones where I had a lot of anxiety ones, like seizures that were just these awful, awful, intense moments of anxiety. And lots of times, like I said, the deja vu would come first, and then the intense anxiety and or feeling of doom. And the way I described it was the worst mistake of my life. So it was like I felt that it was going to be my fault, whatever I did next, and whatever I did next was the worst mistake of my life. So trying to think around all of this is so difficult, because when I would have the seizure, then it takes me about 2 hours to get over the seizure, the postictal period. And I know that now. The hard part is that, those are actually smaller than these old ones, less intense, and yet I know now that they take me a couple hours to get totally out of the confusion. How confused I get right after a seizure is hard to explain, because I have managed to just plow through it so many times. I didn't want to share with people that I was having these extreme out there emotions suddenly that I couldn't describe barely, and also I couldn't explain. And so I didn't want to tell people about it. So I didn't. I would just hide it from them. And so what that meant was that nobody knew what was going on. So I wasn't telling anybody I'm having this experience, and then somebody could say, oh, that's a seizure. Well, I don't know one person who has this type of seizures who knows that this is epilepsy. I never met someone who said, oh, I have these seizures that are really strange and this is what they're like. I don't really know hardly anyone with epilepsy in the first place. So I've made a lot more contacts and friends on Facebook and the internet and epilepsy.com and through the Epilepsy Foundation, the Epilepsy Stroll. It's really important to surround yourself with community to get information, ideas. So these simple partial seizures are not simple. They're extremely difficult and extremely intense and really upsetting and confusing, and like I said, just really difficult to deal with. And it takes a couple hours afterward to get out of the confusion. So not only was I confused by the fact that I was having these strange episodes, but it was also confusing because your brain suddenly doesn't feel right. And you feel like you don't know what to do. You can't make decisions. You can't, your head hurts. You can't think straight. I don't know how to explain to people when you just can't think. It's just a different thing. I mean, literally something goes bzzz in your brain and you suddenly are going, and you just can't think clearly. So I think it's really important to learn more about these seizures.